Well, this week is Polycystic Kidney Disease Awareness Week. This disorder is one of the most common life-threatening genetic diseases, and joining me today to talk more about this is PKD patient Peggy Robinson and Pam Lanza, a PKD researcher at the University of Kansas Medical Center. Thank you both so much for joining us.
Thank you for having us.
Now, Peggy, let's start with you. You're living with PKD. What exactly is polycystic kidney disease, and how has it affected your life?
Polycystic kidney disease is a chronic disease that your kidneys fill up with small cysts that are filled with fluid, and the kidneys increase in size, and it affects your kidney function. It causes your blood pressure to be higher, causes pain, and in my case, I've been hospitalized a couple of times from massive infections because it's very difficult to control that infection. And I take blood pressure medicine in increasing amounts. We have many people in my family are affected. It's a family disease. There are 8 siblings in my family. 6 of us have been diagnosed.
Now, so you take medications and I guess treatments to kind of keep you comfortable, but you're not really stopping the disease, or are you?
It's really not stopping the disease at all. We treat the symptoms at this point. There is nothing that stops the progression. The progression can be slowed by affecting our diet, watching our salt intake, and drinking plenty of fluids, and lower protein diet. So.
And just to give our viewers an idea of your kidneys enlarging, I had heard an example given once that in some cases the kidney is the size of a football in your body.
They can get that big. The last time mine were measured, they were 3 times the size that they normally would be. They should be the size of your fist. It's 3 times taller and wider than that.
Affecting your other organs and affecting your body.
I also have some effect in my lungs because everything's pushed up, and you have reflux because everything's pushed up because the kidneys are taking up so much room.
Well, individuals like Peggy who are living with PKD, that is the reason why you're doing what you're doing, Pam, and that is researching a cure.
Yes, we have several studies going on. The PKD website, the foundation, we're partnered with them. The foundation has a website that lists the available studies that are going on, so that's a good resource for people if they're interested in participating and helping us understand more how to treat this disease.
Now, as a researcher, can you give us an idea of where we are in terms of finding a cure? I mean, is it still in the beginning stages of research, or where are we?
Well, that's a great point. 25 years ago, there was nothing going on, and I know the kidneys grow slowly, but we're making more progress. We're finding new treatments, new medications. We're looking at the genetic modifiers that are affecting the genes that control the progression of the disease. So we are making progress. Probably not quick enough for Peggy and her family, but we're working hard.
Absolutely. Well, of course, any sort of research needs funding to support it, and so we want to tell you about an event that is coming up. It's a little bit of ways away, it's a couple months, so you can prepare for this. Saturday, September 11th is the Kansas City Walk for PKD. It's at Avila University. Starts at 10:30 in the morning. It's a 2-mile walk, and it is going to be one of many walks across the country during the month of September in support of finding a cure for PKD. Peggy and Pam, thank you both so much for coming.
Thank you.